I'm Sissi Goh. This is my friend Dr. Anthony Tang.
Hi there.
Hi. So today I'm at his clinic at Paragon Orchard, Singapore. And the name is the Breast Clinic.
That's right.
Later we'll have a little tour of the clinic so that you can see how it looks like.
Okay, that's a good idea.
Right. I guess a lot of people want to know, what does a breast cancer surgeon do?
Oh, okay. So I'm a breast oncoplastic surgeon. So what I deal with is all sorts of breast problems, okay? Whether it's pain or whether the lady feels a lump or whether it is something they see on the breast, is some redness, etc. and all that. So sometimes it's infection, sometimes it is a lump that is not dangerous, but sometimes, of course, it's cancer. A lady would come to see me for any of these kind of problems. Then what I'll do is I'll arrange the necessary scan.
So you can arrange the scan?
Absolutely. So sometimes I do the scan, sometimes I arrange for the scan to be done. Then of course, if necessary, we do biopsies. So biopsy is a way in which we confirm the nature of a particular lump or a particular lesion that we see in the breast. Then after the biopsy, of course, if necessary, to do an operation, say for cancer and all that, then I would carry that out as well.
So will you do it over here or in a private hospital? Or?
So the investigations, in other words, the scans and the biopsies, can actually be done in Paragon, and the biopsies itself can be done in this clinic itself.
Yeah, it's a pretty big clinic.
But sometimes this is because of constraints by the particular provider, it's the insurance company, and they may dictate that it's done in, let's say, a day surgery center or it's done in a hospital. Then I would do it also, but in whatever setting that's necessary. It's dictated by the insurance company.
Yes, this breast clinic is on a few insurance panels.
That's right.
Do you have a lot of clients coming from overseas?
I used to, and I still do have a lot of queries from overseas, from Vietnam and Indonesia especially, some from China. In the past, it used to be a lot of Indonesians, but the number of Indonesians has gone down a little bit now because of COVID and all that. So currently, the number of foreign patients coming in is severely restricted. But every once in a while, when the restrictions are lifted, then I do get 1 or 2 patients who come in, and then sometimes, which is my experience the past few months, then after that the borders lock down again, kind of thing. So only 1 or 2 patients got in, and then we treat them, but there are a few others waiting, but we can't treat them anymore.
Then they have to wait for the next round.
So what I try to do for them is to tell them how to get treatment in their particular country. Because I think it's a problem all over the world. It's not just here in Singapore, that all these borders are closed, so they can't really go anywhere for treatment and all that. So unfortunately, so I'm just trying to find the best solution for them in their own country.
All right. So why do you think people will come all the way to Singapore for treatment? Is there any competitive advantage we have?
I think there is. So I think a lot of people still do trust Singapore's medical system as what's known as the gold standard. It's like the leading healthcare system in this particular region. Kind of thing, in terms of everything. For example, in terms of the quality of the scan, in terms of the accuracy of, let's say, the biopsy. So for example, a doctor can take out something, let's say take out a sample of a lump and send it to the lab. Now what I'm going to be doing for the patient next, how I'm treating the patient really depends on what the lab says this thing is. So if the lab says, oh, this is not dangerous, that's it. The doctor doesn't do anything else, right? But if the lab says, oh, this is potentially cancer, then the doctor will act on it and do something, right? Kind of thing. So it's very important, not just the doctor's skill, but the whole system, from the scans, the x-rays or the CTs, MRIs and all that, to these things, the biopsies, the lab reading a specimen to say what kind of cancer is this and all that, to nowadays, especially in this era of personalization, customization of treatment to the patient. So there are a lot of factors. So now it's not just, oh, you have this cancer. It's what subtype of cancer do you have?
Right.
Right? And there are many things that we test for in the cancer as well. And so some regions, unfortunately, do not do this as well as Singapore. Yeah, and therefore treatment can be slightly skewed, perhaps a bit not so right in some other places. And so I think a lot of people still do trust Singapore for its accuracy and its speedy providing of medical care. That's right, the quality of care as well. So a lot of people still, want to come here.
Right.
Although I must say, compared to the region, it is pretty expensive. The Sing dollar is pretty strong, right?
Right,
in the
price
region.
is what you pay, value is what you get.
Yeah, so it's like, right.
I personally have a few clients who have already gotten breast cancer in their 40s and 50s. Why do you think it's the reason? Like, how come there are so many people getting breast cancer nowadays?
That's a very good question. I think with the medical knowledge that we have right now, I can only partially answer this. Okay, so nowadays the awareness of breast cancer is a lot higher, and hence a lot of people do go for screening. So screening is basically going for a test, usually in the form of a mammogram, before you get any symptom. That means there's no pain, you don't feel any lump, nothing, but you just go to test. And sometimes we do pick up cancers at a very early stage. Okay. Yeah, so when you go for screening now, a lot of people are going for testing. Okay, so it's like, you don't even have any problem, but now we find that actually there is an early problem brewing.
Okay.
Yeah, so that's one of the reasons why we find more cancers nowadays. Okay, there's only one. But if you talk amongst a lot of breast cancer doctors, you would find also that everyone agrees that a lot of our patients are getting younger as well. Okay, so in the past, in the past, it used to be, a disease predominantly of patients in their 60s, 70s, a lot older, but now we get a lot of patients, even in their 30s, as young as sometimes in their 20s, getting breast cancer as well. Now, why are they getting breast cancer? Why is there more of them getting breast cancer? We know one of the reasons is because of a genetic predisposition, but genes only accounts for maybe about 15% of breast cancers. In other words, the rest, we don't know why.
Right.
We just know that they are getting younger and younger, but we don't know why.
Maybe it's the food or the lifestyle.
It could be a lot of things. So the way, sometimes I get this, asked this very often. So I often joke with my friends as well, right? I said there are actually a lot of things in our modern lifestyle which we have, taken as part and parcel of everyday life already, right? But we never question whether it's dangerous. For example, right, most people have Wi-Fi around them 24/7, right?
Right.
Yeah, it's really 24/7, perpetual Wi-Fi all the time.
Right.
Yeah, and nobody knows whether the Wi-Fi has got any bad repercussions over a long period of time.
Exactly.
Right. So there are a lot of these things we don't know. Obviously nowadays foods are prepared differently as well. There's a lot of and does this accumulative effect have something which then makes people more predisposed towards cancer at a younger age? We don't know. Yeah, so we don't, maybe there are too many factors. Maybe every one of these things play a small role.
Exactly.
And accumulation of all these factors, causes the early breast cancer. We don't know. So right now, we know how to treat the cancer.
Right.
But how do we stop this from forming in the first place? That part we still don't know. Some of the questions I get asked is like that. Like, if I keep my phone in my pocket, in the breast pocket, does it cause cancer to grow? I can't answer that because nobody has ever done a trial, and most people, you keep it in your, like for ladies anyway, you keep it in your handbag, right?
Right.
You don't put it here, put it in a handbag.
No, sometimes you lie on the bed, right? Then you read messages afterward, fall asleep, who knows?
That's true, right? Yeah, but does it like increase the chance of cancer? No, nobody knows. But nowadays, cancer is like diabetes. Right. We can beat this, right? But you may need to do certain things.
Right.
Right? Like if you have diabetes, you need to control your diet very well.
Mm.
Right? You can't say, oh, I want to beat diabetes, but I just want to eat everything I want to eat. No,
Right.
you can't. You have to do something now, right?
You have to be disciplined.
That's right. So for cancer as well, okay, you need to do certain things. Sometimes you need surgery, sometimes you need certain medication, chemotherapy, etc., and all that. But nowadays, with modern medicine, we can certainly cure and beat cancer. Right. So it is not a death sentence. You know, in the past 30, 40 years ago, you know, it was almost immediate death sentence. You have cancer, at most 2 years, you're going to die already, you know, kind of thing. But it's not like that nowadays, yeah,
right.
kind of thing. So I think that message needs to go out as well, so that if anyone notices anything different, like they suddenly notice a lump or something, they're not afraid to go and look for help.
Yes.
Yeah. So the message should be for everyone is that cancer is no longer a death sentence, especially early breast cancer. These are all definitely treatable, okay, and almost certainly curable as well.
Right. So don't be afraid. Just come and look for Dr. Tan.
If any problems, yeah, that's right. Not to scare everyone, but you know, as you alluded to earlier, you were saying, you know, it's quite common. So how common is this cancer? One in an Asian population, okay, average 1 in 10, okay, which is a lot.
A lot.
Okay, there's no other cancer which occurs in 10% of people. It's a lot. Okay.
And that includes male as well, right?
Yes, but male is a very small percentage. So that's why a lot of my talks are usually aimed towards ladies, kind of thing. But we can talk about male breast cancer as well. Basically 1 in 10, almost 1 in 10. In the West, okay, it's even more. It's like 1 in 7.
Right.
Okay, kind of thing. So over here, it's around about 1 in 10. So, as I mentioned before, okay, early breast cancer is definitely treatable. Definitely curable, right? Okay, so what do people need to know? What does every woman need to know about breast cancer? Okay, the most important message is in very early breast cancer, when the cancer is small, okay,
like a cyst or fibroid.
So it's a cancer, yeah. So it's different. It's not cyst or fibroid anymore, yeah. So let's say it's cancer, and the cancer is like small, okay. You actually have no symptoms. You don't get any pain. You cannot feel the lump because it's too small.
Right.
Right? The area of the breast doesn't become red. You don't suddenly get headache on that side or something. Nothing. You don't know that the cancer is slowly growing. Okay? So it's a bit of a conundrum, right? I said, we need to find the cancer early. But now I'm telling you, at the early stage, there's no sign.
Right.
Right? Okay. So breast cancer is different from other disease. Any other disease, if there's pain, something's wrong. So people wait for pain. Yeah, like your pain at the tooth, or quickly go and see dentist.
Right.
You know, kind of thing. Breast cancer is the opposite. Okay, cancers are almost certainly not painful. So there's no sign. So how do you find it early? The only way to find it early,
mammogram.
Correct, is to go for your yearly scans, especially from the age of 40. Okay, so from the age of 40, every lady, whether you feel pain or not, or whether you feel the presence of a lump or not, or whether there's anything going on, every lady should make it a decision to go once a year for a mammogram. Right. Okay, that's the only way we can pick up cancers early.
Okay, but mammogram itself is quite painful.
Well, it is a bit uncomfortable, I think, for most ladies, yeah. But okay, it's, you know, I'm not saying you have to do it every day, you know.
Once a year.
It's even once a year, yeah. Like right now, okay, I'm not saying that it's, you know, I need to go for a COVID swab once every 2 weeks now as a medical practitioner, right? So you get poked in. Well, it's not comfortable, but for the greater good of everyone, okay, once every 2 weeks I go, right? Okay. And they're telling me that potentially I need to go every week.
Oh no.
So I'm like, okay, like, you know, wow, okay. But okay, if you're telling me, you know, it's going to do good for myself, yeah, and also for everyone else, okay, then I'll go for it, right? But, you know, mammogram is not like this. It's not like every week you're going for this, right? It's only once a year, right? And, you know, if you tell everyone, once a year go for a health check, get blood taken. You know, taking blood, you need to poke also, right? It's also a bit uncomfortable. But most people will still go for it, right?
Right. Okay. We need to look at the big picture.
Yeah.
Okay.
So I think if it's once a year
Point
and
taken.
it can potentially save lives, okay, and not only that, when the cancer is small, we can definitely save the breast as well.
Yeah.
Yeah, we can just remove the cancer itself. Yeah. So because you can save lives and save breasts, you know, I think once a year mammogram is not too big an ask.
Right. My last question.
Oh, okay.
How about a fun fact
Okay.
of breast cancer surgeon? Like something that other people don't know, or something that you have never told other people.
Fun fact about myself or about breast cancer surgeons in general?
Or both.
Or both. Okay.
I need to make my video exclusive. Something that other people don't know.
Okay. I think it's a well-known fact amongst medical circles. Okay, but other people may not know. But a lot of surgeons enjoy their wines. After hours, of course.
I even saw you like teaching other people how to appreciate wine. And I learned something new because
really?
I don't drink.
Okay.
So I was like, oh, that's how you differentiate white wine from champagne.
A lot of doctors do enjoy their wine. Yeah. Okay. So if you want your doctor to treat you well, you know what kind of present you might want to give them. Kidding.
That's a good one. Now I know.
There you go.
Okay, thank you, Dr. Tian, for your sharing.
Most welcome, Sissi. Most welcome. Okay, well, welcome to the breast clinic. We're over in Paragon Medical Center, in Paragon itself, level 16. And please come on in.
Okay.
So this is our front reception area. And I think this is where our patients and all that have a seat while waiting for their turn to be seen.
Where did you get the painting? So pretty.
Well, this is actually done by one of my now good friends who is a Korean folk painting artist. And these paintings were at that time done as part of a charity event. And so then I decided, wow, these are really pretty, and I wanted to contribute towards a good cause as well. So I thought, oh, why don't we do this, kill two birds with one stone, so to speak, kind of thing. So that's what I did. So I got this from her. So come on in, we've got a few rooms, but I'll show you my room.
Okay.
Okay. So this is the main clinical consult room. Okay, you see this is where I see my patients and all. Okay, and then this is the examination couch and the ultrasound that we have. If the patient needs something like a biopsy or something. Alright, so this is the room that they come in to get changed, to get ready for the procedure. Okay, so this is our treatment room. Right? And the most common procedure we do here is biopsies. And so a biopsy is a process where we get a small tissue sample from a lump to test to make sure we know exactly what the lump is. Yeah, and usually it's to know whether it's a cancerous lesion or not. So there's many various tools and all that we have around here to do this particular process.